Good morning. This has been a fantastic weekend to celebrate fantastic women. And I am so grateful that we are able to have these beautiful ladies in front of us today. Don't they look lovely? Thank you for joining us today at the American Pharmacists Association National Headquarters. I am Dr. Anjanette Wyatt, President of the APhA Foundation Board of Directors. And it gives me great honor and a pleasure to introduce a dynamic lady who's a female pharmacist, and she is my Vice President, Elizabeth Johnson.
Good morning. It's great to see everybody here this morning, and thank you to everybody who is dialed in remotely from their homes or work or wherever they are. It's great to be convened early on a Saturday. So as Anjanette mentioned, I'm Elizabeth Johnson, Vice President of the APhA Foundation and Chair of the Women in Pharmacy Committee. And it's, again, great to have you all here at APhA headquarters. And I'm pleased to welcome you this morning to Women in Pharmacy, a showcase on women of influence in the profession. I would also like to welcome everybody that has dialed in on Zoom. The APhA Foundation Women in Pharmacy Committee is dedicated to ensuring that the outstanding achievements of women in the profession are recognized and celebrated. Through activities organized by the APhA Foundation and the Women in Pharmacy Committee, we provide resources related to leadership development, networking, and balancing the demands of career and personal life. I'd like to recognize the members of the Women in Pharmacy Committee who have worked hard this year to identify and develop the programming we've offered. Would any of the committee members who are here in the room please stand? Thank you for their hard work. It's definitely a working committee. Some may have gotten more than they signed up for. During our program last October, we announced a special recognition campaign to honor 10 outstanding pharmacy professionals within the Women in Pharmacy exhibit and conference room here at APhA headquarters. The exhibit and conference room, dedicated in 2012, celebrates the achievements of remarkable women throughout the history of pharmacy. The room is a tribute to women who have had a profound influence on the profession and highlights many firsts for women in U.S. pharmacy. I would like to recognize a special guest in our audience today, Joy Donaldson. Joy is one of the original honorees recognized as part of the Women in Pharmacy dedication in 2012. And we were so excited that she traveled to Washington, D.C. from New Mexico with her daughter, Cecilia, to be here with us. And we really appreciate you being here, Joy. To mark the 10-year anniversary of the initial dedication, the next 10 Women in Pharmacy honorees were formally recognized last evening and joined the distinguished roster of those similarly honored in 2012. This morning, we would like to continue celebrating these wonderful women by engaging in a dialogue with their perspectives on practice innovation, leadership, mentorship, and community service and philanthropy. Can we please have another round of applause for the next 10 honorees who compose our panel this morning? I would like to thank our generous supporters of today's program, Bristol Myers Squibb, Cardinal Health, Gainwell Technologies, and Moderna. Brian, do we have that slide? I'd like to welcome Dr. Pamela Gobina from Moderna to the podium.
Thank you. Good morning. The ones who are crazy enough to think they can change the world are usually the ones that do. I don't know about you, but I think pharmacists are crazy. In fact, I know we are. We're crazy amazing. Just look at what you've done in the past actually almost 3 years now since the pandemic hit. Not only were you thrown to the forefront and practically became the face of immunizing overnight, you changed the world. You changed the way pharmacists are viewed and valued as part of the healthcare team. You stepped up without question, without hesitation, when vaccines needed to get into arms. Your normal day changed overnight. Not only were you verifying prescriptions, counseling patients, catching errors, I think we all know about that, you're now suddenly vaccinating all day long as well. You became magicians because you have to be some kind of magical being to keep up with all that you do and more. Pharmacists are the essential healthcare worker. Pharmacists are the key to increased vaccination rates. There are more pharmacies in low-income areas than there are physicians' offices. And a lot of you even went above and beyond the call of standard duty and went out into your communities, vaccinating people in their homes, in clinics, in long-term care facilities, nursing homes, stadiums, churches. You all were there, working tirelessly, giving up time with your families, vacation time. I'm sure many of you haven't even slept in the last 2 years. Unfortunately, as pharmacists, a lot of what we do is like an iceberg. People only see this much of what you do, when most of what you do is actually beneath the surface, unseen. We as pharmacists often get overlooked and go underappreciated. The job of a pharmacist is sometimes a very thankless job. Well, I want to say thank you. And we at Moderna, we see you. We see all that you've done and we thank you. We thank you for being the essential bridge to getting us to where we are today. We created the vaccine, but how useful would it be if it never got into the arms, if you all didn't get them into the arms of patients? More than 50% of vaccinations have been given in the US, which is somewhere in the realm of 270 million doses have been administered by community pharmacists. And that doesn't even include the pharmacists in other practice settings. You all did that. And I've never been more proud to be a pharmacist than I am today. And I'm so honored to be in this room with all these amazing women and amazing pharmacists who are crazy enough to go out and change the world. Thank you.
Thank you, Pam. Now, please turn your attention to a welcome video provided by Gainwell Technologies.
Prescription drug programs are complex, confusing, and cumbersome. In short, they're a headache. Your painkiller has arrived. Pharmacy costs are rising. 44% of prescriptions written today are expensive specialty medicines, so it's crucial that your Medicaid program is modern, adaptive, and built to serve. Many state agencies are moving pharmacy claims processing from managed care back to fee-for-service, so you'll want a solution that is flexible. We've got you covered and then some with our deep clinical expertise. Our end-to-end prospective and retrospective pharmacy claim solution will make your life easier. Step up to a streamlined pharmacy solution. CMS approved, modular, and interoperable. Save headaches, save money, stay compliant. Pharmacy solutions from Gainwell, a safe pair of hands for over 50 years.
Thank you once again to Gainwell Technologies, Moderna, Cardinal Health, and Bristol Myers Squibb for generously supporting our program. For today's showcase, we are delighted to have Dr. Mary Alice Bennett, Dr. Bettina Black, Dr. Cynthia Boyle, Dr. Janet Engel, Dr. Kelly Good, Dr. Metalou Henderson, Dr. Lucinda Main, Dr. Magali Rodriguez de Bittner, Dr. Beverly Schaefer, and retired Rear Admiral Dr. Pamela Schweitzer. Let's take a moment to learn a bit about these extraordinary women.
Situated in the heart of America's capital, the American Pharmacists Association and the APhA Foundation are proud to be neighbors of the National Academy of Science, the Institute of Peace, and the Lincoln Memorial along the National Mall. These majestic surroundings are the perfect backdrop for celebrating the achievements of remarkable women throughout the history of pharmacy. Located on the top floor of APhA headquarters, the Women in Pharmacy exhibit and conference room is a visible reminder of women's significant role in the profession and their vision that brought us here and moves us forward. The portrait wall in the room, which was dedicated in 2012, is a tribute to women of influence that highlights many firsts for women in U.S. pharmacy. APhA Foundation is proud to commemorate the dedication's 10th anniversary by honoring the next 10 women who joined the distinguished roster of individuals and organizations similarly honored in 2012. Mary Alice Bennett is one of the first pharmacists in the country to create and implement inpatient clinical pharmacy services, and is a respected leader known for her pioneering vision for advancing patient care in community-based practice. Mary Alice served as president of APhA in 2010 to 2011 and received the Remington Honor Medal in 2021. Bettina Black is the first woman president of the Tennessee Pharmacists Association and their first woman executive director as well. Bettina's career has spanned multiple areas in pharmacy, including community, long-term care, industry, and state association. Bettina has received numerous awards, including the Hugo Schaefer Award in 2015. Cynthia Boyle is the first woman elected as Speaker of the AACP House of Delegates and served as the 2015 to 2016 AACP President. Cynthia has served as President of the Maryland Pharmacists Association and its foundation. She is also a former national president of Phi Lambda Sigma. Cynthia has received many awards throughout her career, including the Bowl of Hygeia Award and most recently the 2022 Robert K. Chalmers Distinguished Pharmacy Educator Award. Janet Engel is currently the Executive Director of the Accreditation Council for Pharmacy Education. She has served as President of APhA, was elected as a Distinguished Practitioner in the National Academies of Practice, and was named an APhA and ACCP Fellow. Amongst many other awards, Janet received the APhA Distinguished Achievement Award for Clinical Pharmacotherapeutic Practice. Kelly R. Good is considered an expert in pharmacy-based immunization delivery and is the APhA liaison member to the National Vaccine Advisory Committee. Kelly has been the recipient of many awards, including the inaugural NACDS Foundation Community Pharmacy Faculty Award, and she is the 7th woman recipient of the APhA Daniel B. Smith Practice Excellence Award. Kelly served as the 161st president of APhA. Meta Lou Henderson has served as APhA Honorary President and the Grand President of Kappa Epsilon Fraternity. Meta Lou was the recipient of the APhA Gloria Niemeyer Franke Leadership Mentor Award and has documented and written extensively on women pharmacists, including the book American Women Pharmacists' Contributions to the Profession. Lucinda Main served as the 2nd female president of Student APhA, Speaker of the APhA House of Delegates, and as a trustee. Lucinda was the recipient of the Gloria Niemeyer Franke Leadership Mentor Award in 2018 and was the 6th woman to receive the Remington Honor Medal. Lucinda's career included 10 years on staff at APhA and is culminated with 20 years as EVP and CEO of AACP. Magali Rodriguez de Bittner, a professor at University of Maryland, Baltimore, was the first woman to receive the Maryland Bowl of Hygeia. Magali's passion and vision for pharmacy led to innovative programs such as the Maryland P3. Magali has served as an executive director of the Center for Innovative Pharmacy Solutions, an APhA trustee, and a former president of both the APhA Foundation and Maryland Pharmacists Association. Beverly Schaefer's leadership efforts in being one of the first pharmacists to provide patient immunizations was groundbreaking and life-changing for the pharmacy profession and patients. Beverly states, "Providing immunizations helped ignite a revolution in public health and spurred evolution of pharmacy practice to include other patient care services, point-of-care testing, collaborative prescribing, and pharmacists helping patients lead their healthiest lives. Rear Admiral Pamela Schweitzer served 29 years of her career in federal service, including the Indian Health Service, Veterans Health Administration, and Centers for Medicare and Medicaid Services. Pamela served as the 10th Chief Pharmacist Officer in the U.S. Public Health Service Commissioned Corps, and she was the first female in this role. The APhA Foundation congratulates the distinguished women honored today through the Women in Pharmacy Recognition Campaign. Thank you for the outstanding contributions you have made and continue to make towards advancing patient health, and the remarkable example you set for current and future generations of pharmacists to follow in your lead.
Congratulations to each of our honorees. I'd now like to introduce Dr. Farah Tofik, who will lead our discussion as moderator. And I just want to thank Farah again for taking this on. And biggest challenge for everybody today is many people that we want to hear from in limited time. So I know we'll leave you wanting more, but we didn't have a 6-hour program to do today. So here you go, Farah.
Thank you so much, Elizabeth. It's truly an honor to be with everyone today. Hello to our remote participants and everyone in the room. We are very, very excited to have this panel discussion. So we have a couple of housekeeping items to go over before we get started. For those attending on Zoom, please remember to keep your microphones muted. You're all doing a great job with that, so keep it up. But following the discussion, we will have a Q&A where we will welcome you to raise your hand. You'll be acknowledged, and then we'll want you to submit questions. I think it'll enrich our dialogue, and we'll also have microphones in the room. So for those in the room, as you're hearing from these exceptional women and their stories, please think of those questions. We will make sure that we have time for that engaging dialogue that will enrich this experience even more. So, as Elizabeth mentioned, we've invited the next 10 Women in Pharmacy honorees to share their insights as they relate to practice innovation, leadership, mentorship, community service, as well as philanthropy. So now I'll transition over to my lavalier microphone and kick off our lovely panel discussion today, which we're really excited to have. So Bettina, I'd like to start our discussion with you. So you have practiced in many settings. We heard a little about that on the video, from community to hospital to long-term care industry, as well as association management. So can you share how you made some of those transitions, and specifically what advice would you give for someone considering a career change within pharmacy?
Thanks, Farah, and it's truly an honor to be a member of this group. It's been an amazing experience. They have given us a very short period of time to respond. As a Southerner with this accent, Joy, I'm afraid I may be talking a little fast, and I apologize. I've been so blessed in my career. And some of the things I think I would like to share in terms of advice or tips and how I did some of the things I did was, I think that early on in your experience as a pharmacist, you need to really think about what you're passionate about and develop some type of goal or mission as to what you want to accomplish in your career. And then you need to get involved. Need to go out and investigate what's going on. The best way to do that is join organizations, associations, state, national, and network. I say network, network, network. And while I've been blessed to network with many women, I will tell you early in my career, the network was mostly men. They were very kind and very open to networking with me. The other thing is, I think you have to be brave and ask questions. It's important to ask questions. Asking questions doesn't mean that you don't understand or that you don't have knowledge. It's expanding and gaining a deeper appreciation and understanding. And then beyond that, I think you really do try to find those people that you want to develop a real relationship with that can offer you even deeper advice. And then I think you have to be willing to take risk. Never be afraid to take risks. They need to be a bit calculated, but certainly when you're changing what you've been doing in your life to something totally different, it is a risk-taking experience for sure. And then I think you have to volunteer for things. I think you have to step up and be willing, because honestly, I think you learn more in those experiences. Say yes to things that you're passionate about that seem to advance the things that you're interested in learning more about. As to how I made the transitions, I really attribute that to the advice that I've given about networking and asking questions, because the experiences where I transitioned from doing one thing to something else came about by people that were in my network, were in my trusted peer group, who actually came and approached me and said, hey, we've got this opportunity. Would you perhaps be interested? Some of those were easier than others. Some of them involved moving away from friends and everything else. That's where that risk advice comes in. But I think all of those different opportunities, some didn't even exist when I finished school. But I would tell everybody it's totally worth it to step out and offer to assume new leadership positions.
Thank you so much, Bettina. And I hope you all heard the part about asking questions and the importance of that. And then, of course, taking risks. You'll see that that's a theme that you hear from all of these women throughout today's panel. So thank you, Bettina. All right, so Mary Ellis, your career has supported advancement of community pharmacy residency programs, among many, many other areas. So tell us your vision for the role of community pharmacy practice and how student pharmacists should consider opportunities for careers in community pharmacy practice going forward.
Thanks, Farah. I'm excited to respond to that. I think this is a really exciting time to be a community pharmacist, although it may not always feel that way in the trenches over the last 3 years, but I'm so proud of what pharmacists have done. And it's what we always do, but we just shine doing it in the last 3 years. And so as we look at our healthcare delivery system, one of the main goals is to keep patients out of the hospital, and we're going to do that in the community. And so I think the pharmacist just sits right where, as I always say, patients live, work, play, and pray. And we're right in their communities, and we are part of their everyday lives. And we have the opportunity to really keep people well, even with chronic disease states. So I see the community practitioner branching out into being more like a hub for managing medications. I see us owning that medication list. That's going to be the key to keeping this fractionated healthcare system less fractionated and better for the patient. So I see the pharmacy or some community-based place as being the hub, but I see pharmacists leaving that hub and going to the churches and going to the Y and going to the barber shop and going to where, the work site, us going to the patient rather than waiting for the patient to come to us when they're not well, and really building it on a wellness and prevention model. Even if you have diabetes or cardiovascular disease, keeping you well and preventing complications from chronic disease states. So I think the community pharmacist is just beautifully positioned to be that hub and reach out with those folks out into the community and keep our patients healthy and well. And what I would tell any young student, I would say a practitioner that's thinking about making a job change, a PGY1 community-based residency would be a golden opportunity to learn the skills on how to go out and create new practices and change the way things are delivered. I always say your favorite job's one that doesn't exist today. And so you can go out and create it, take a risk and go out and create it.
Thank you so much, Mary Ellis. And we certainly, those of us who were here for the Pinnacle Awards program, saw how pharmacists are owning that medication list and helping support patients. So this is truly astonishing for the pharmacy profession. It's wonderful. All right, so Kelly, you were the first female student body president at your alma mater, so VCU School of Pharmacy, and the first female full professor in a non-tenure track position, also at VCU. And your nomination letters really mentioned your role mentoring other pharmacists, student pharmacists, women pharmacists over the years. So can you comment on what it has meant for you to achieve all these firsts and your approach to mentorship. What have you learned about how to be a woman in pharmacy and advanced profession?
Thanks, Farah. I'm really excited to be here today. First, I'll start is I really don't think about it as being first or that I'm a woman. The key is really to focus on who you are, what are your skills and interests, and how do you work with others to achieve these goals. Don't ever let anyone tell you that you can't. Be brave and bold and at least give it a try. You will never get the chance or opportunity if you don't try. And be persistent and assertive. If you're knocked down, dust off the dirt and get back up. I've done this numerous times in my career. And then finally, mentoring is really important, not only to be a mentor, but to have mentors. My approach to mentoring is not to focus on creating mentees who are just like me or have my same interests, but about offering what I know and perhaps any biases that might impact my opinion and helping my mentee make the best decision for them to achieve his or her goals, both personally and professionally. I am extremely proud of the residents and students where I've had a role in their professional journey. On the other side, I have mentors across the country in different areas of practice who are both men and women. We are both mentor, mentee, friend, and colleague. It's what makes professional and personal growth so rewarding.
Thank you, Kelly. Thank you for that. And I know many of us in this room have had mentors that have helped us along these journeys. And that's certainly something that we have to keep in mind and continue to support students in finding the right mentors towards their career. So now, Metalou, you were the first recipient and namesake of the Dr. Metalou Henderson Award for Excellence in Academia, given by Kappa Epsilon to recognize teaching, scholarship, leadership, and service and advancement of the profession. Can you comment on the leadership and service aspects of that award, and particularly how you feel you have contributed in those areas throughout your storied career, knowing that we've about a minute and a half to answer, so. Easy, right?
I think you've given me the most difficult question of anybody here. First of all, I am so honored and I'm so humble to have had this award named for me. It was quite a surprise. It was given via Zoom, of course, and I turned around in my casita and there was the dean from Ohio Northern University, as well as my nephew, since they had planned all this along with KE. The award is to be given to a KE who is a faculty member. That's part of the criteria. And leadership and service requirements certainly relates to their sustained service to pharmacy through academia, including leadership, not only within the academic setting, but also outside, and to working with students. The idea is that this individual will be a role model and a mentor to student pharmacists. I guess I have to say, I think that I've been a mentor and a mentee to many pharmacists and certainly mentors to many pharmacy students to show them that you can do these things. And I'm not saying only females, I also enjoy mentoring males as well, because together, this is the future of pharmacy, to show them that you can do these things, that you can be active in pharmacy organizations. And I think the most fun over years would be like to an APHA meeting, look over my shoulder and find one of my students following me so that I would introduce them to somebody else. And then my response to them is, okay, in turn, you're going to turn around and introduce somebody else. So
wonderful. Thank you so much, Metalou. All right, Lucinda, you've been a very busy pharmacist as a student leader in academia and as executive staff with an APHA, as we saw in the video, as well as AACP. That could be plenty to satisfy most people, but how and why have you chosen to prioritize philanthropy and community service in addition to your leadership within the pharmacy profession?
Thanks, Farah. Again, a little difficult to do in 90 seconds, but I'll give it my best. As I think about it, I like to admit that early in my career, I was very linear. And what I mean by that is when I was in school at Auburn in Minnesota, I was a student. Now, I was a student leader, yes, but I wasn't married. I only worked summers until I got into graduate school. But then I began the profession, and I was, in my career, I was a faculty member and an administrator at Samford. And then lo and behold, I married a student. He wasn't a student anymore when he got married. But I married Dan Albrand. And so then I had this, I'm a career woman, but I'm married. And so I've started a family. We were married for 10 years before we adopted our 2 boys. And I will attribute this to Jan Skelton, who said, Lucinda, and many of you know Jan Skelton, so this won't surprise you at all. Once you became a mom, you were much more fun to work with. And so I think that goes to the issue associated with finding balance. And I know work-life balance is a term that I have struck from my vocabulary because it doesn't exist. If you have a robust, any of those things. But then I think about your question about, giving back and of course, being involved in associations is the thread that goes through all of what I just described. But once we got the boys, we got very, very involved in Mount Olivet United Methodist Church, which is just about 3 miles from here. And Dan was involved spiritually, and that led him to become Pastor Dan rather than pharmacist only Dan. And I now think about that as 3 legs on the stool, which is the balanced position, if you think about it. And, you've got to kind of mix and match. You've got to know when to say, Uncle, I can't do any more. And I'm trying to do that now in my preferment, and, it's almost working. But at any rate, and then finally, every single element of that done well enriches me personally, and it just perpetuates itself. And so that's the gasoline, I guess you could say, to being able to participate at all of those levels, at the high octane level. So thanks.
Thank you, Lucinda. It's truly inspiring to hear these stories and truly to be together to hear these stories. I know you mentioned, Metaloo, that it was via Zoom that you had that recognition for your award as well. And it's exciting to be together. So Cynthia, you have also been very heavily involved in philanthropy. We saw an example of that just yesterday through the generous portrait that you commissioned with Ray. So can you share some of your experience in giving and what you look for when deciding which organizations to contribute to?
I love this topic. I'll continue what Dr. Main was saying. I love talking about philanthropy, and we don't. And I think it may stem from the taboo about not talking about money and our salaries. Sometimes maybe we think it has to be later in life in some way, but it really centers on altruistic concern for others. Doesn't that just define pharmacists? So when I'm looking for an opportunity to give, I look, of course, it has to be mission driven. I need to believe in the mission of the organization, but it also has to match my interests. And I will say, I expect things from a philanthropy too. The ones that are the very best communicate well with the givers. They're looking ahead. There are options. And so, for example, I will use the example of APhA Foundation, because here we are, you can choose to give to bricks and mortar or bricks, as it is in the beautiful terrace outside, but also to people. So the scholarships and the other opportunities. Philanthropy can be fun. For example, when we were endowing the Bowl of IG Award, this was nationwide. We wanted a home for it forever. And so in Maryland, we had a Ravens game day watch party, and we expected donations from everybody who attended, and we had a great time. And together we were able to succeed with that endowment. And you mentioned the COVID Heroes campaign. I mean, that's all of us. I mean, a way to recognize these wonderful contributions. So it feels great. It contributes. And I think what I would hope that we take from this is we should share our philanthropic passions more, because you're likely to get allies. Thank you.
Thank you so much, Cynthia. Beverly, you have been an early adopter of many practice innovations, most notably immunizations in particular. Can you tell us a little bit about how you got involved and what motivated you to be an innovator? What has been most rewarding? What have been some of those challenges? How have patient interactions really changed during the COVID-19 pandemic?
So we became immunizers at our pharmacy because we were looking for a patient care service to fill a need for our community. We turned down the major contract in our area and we sent hundreds of families out of our pharmacy, but they still wanted to do business at our pharmacy. So we were looking for a patient care service. And we stumbled upon immunizations. Our Pharmacy Practices Act was written in 1978 and included the language, pharmacists may dispense or administer drugs. And we boldly looked at that and said, we can do it. And so our first year, we were hoping that we could do 300 flu shots, and we ended up doing 1,200 flu shots because we realized people wanted access to healthcare in a convenient manner close to home. You didn't have to take the day off from work. You didn't have to drive downtown to park. You didn't have to sit in a doctor's office full of sick people. So this was something pharmacy could do for patients. And once we hit upon that, I happened to go to our Pharmacy Association meeting in February after that fall, October. And I told everyone there what a success we had had with doing flu shots. And the biggest problem was that we had to go to the bank twice a day because we had so many 10s and 20s in the till. Now, did I get everybody's attention with that? Granted, we all want to be healthcare, promoters and all that, but I have to say that didn't hurt either, that it would be a revenue stream that everybody was happy with. People were happy to pay $10. People were happy to do it for $10. So it just then had a life of its own. And I spent the next 2 or 3 years going to association meetings, talking about how we did it, what the obstacles were, what the pitfalls were. And so it didn't take very long to convince pharmacists that this was something they could all truly do and perform a very valuable service in all of their communities. It was nationwide. It was something universal. So it was a pretty easy sell at that point. And the most rewarding thing was really and truly how fast it was adopted. It was the right thing to do. So we had a lot of satisfaction with that. And, after the last 3 years, go immunizers.
Thank you, Beverly, indeed. Magali, you had a number of practice-related firsts, including the first community pharmacy-based diabetes education self-management program to be recognized by the American Diabetes Association, and you are the inaugural pharmapreneurship endowed professor at University of Maryland. What has been your inspiration over your career to be an innovator and entrepreneur? What advice do you have for others who are interested in taking this path less traveled?
Yeah. Again, thank you so much. I am so happy that I made it and I'm here with you all today. Sorry I missed yesterday. But as I reflected in this question, really took me back to childhood. And I started thinking when I was a kid, how much I love innovation and entrepreneurship. I always was one of those, I'm the oldest of 4 women. And always no and cannot be done, you better don't tell me that, because I was going to do the total opposite. So as I became a pharmacist, got into pharmacy and patient care, they became my inspiration and truly my passion. So this passion really is what inspires me to innovate, what inspires me to do things differently, because I'm always looking for a better way to do things. When people say, well, that cannot be done, why not? Let's find a way to get it done. Solve the challenges. And I never see a no, cannot be done, that's not possible as the final answer. That doesn't exist for me. And I think my husband can attest to that. So my advice to others is all about finding your why, finding your passion. If you find that passion and that why, then let your imagination loose and determine to follow your dream. But you have to set goals. I always set these goals and then I said, what do I have to do to get there? And then do the steps, do the work to get those goals. Again, my residents always know I said innovation is repetitive failure. So if you're going to innovate, be prepared to fail, to stand up, dust it off, and keep going, but it's worth it. So I really encourage everybody to have that innovation and entrepreneurship mindset.
Thank you, Magali. Pam, you are being recognized as the first female appointed as U.S. Assistant Surgeon General and Chief Pharmacist Officer of the U.S. Public Health Service Commission Corps. Can you share a little bit about that journey and how you first got involved with our nation's public health federal uniformed service? And do you have one consistent piece of advice to those many individuals you've mentored within the public health service?
Thank you for the question. And first, I want to just say what an honor it is to represent federal pharmacists that are women, in both uniformed services and in civil servants. It's really an honor to represent them. So regarding my life journey, it was really stars aligned. I happened to get married to you met my husband, some of you in the back there, to this amazing guy that was just adventurous and loved to travel. So that little point there. And then I had just finished up my residency at UC Irvine Medical Center, had my first job, and I went to a pharmacy meeting, probably like an APhA meeting. And while I was there, we had just returned from Alaska. And so if any of you have been to Alaska, know how beautiful it is there. I was going by and I stopped at a booth that attracted me because there were eagles and glaciers and really pretty pictures. It was Dick Church behind the table. So that was it. I had never heard of the U.S. Public Health Service Commission Corps, and he recruited me to the Indian Health Service. My first duty station was Pine Ridge Indian Reservation. And when I got there, it changed my life in a good way. I found people that were passionate about a mission, working with the community, learned about public health. Really, every single person I worked with, and we made lifelong friends that we are friends with to this day, that all were very mission oriented, that were all passionate about making a difference in the world. So fast forward, along the way, getting the opportunity to work with different mentors, different people like I have Chris Watson here. He was my mentor, just giving me these opportunities. Like who would ever guess you'd get an opportunity to be able to just make it really even a bigger difference, not only local, regional, national difference. So I kind of follow the path. So my advice to people is if you're willing to take risks, if you're willing to just get out of your comfort zone, just the world is open to you. It really is your oyster.
Thank you so much, Pam. Along that line, Jan, so several of your letters of support have commented upon your approach to balancing personal life as well as your exceptional professional career. So some of those interests could include kayaking, biking, attending rock concerts, and spending time with family and friends. So as your nominator indicated, as one of your nominators indicated, you reflect the importance of recharging through experiences that are unrelated to pharmacy. Can you comment a little bit about that and the advice you give student pharmacists as well as colleagues about paying attention to your own well-being? How have you built your identity beyond your career in pharmacy?
Well, first, let me say it's a huge honor to be here. I still don't really have my head around it, but here we are. What I tell students and residents, I think the goal is time management. And that sounds simple, but for me, that's been really important. So for me, for example, family was really important. I have 2 kids and I wanted to make sure that I was home in the afternoons to make sure homework got done, supervise what was going on in the house, make dinner, all that sort of stuff. And to do that, we had to really think about time management. Now, some of the things that work for me aren't going to necessarily work for everybody, but in our case, we made some purposeful decisions. My husband's a pharmacist, which is very helpful, I will say, but we made the decision to live close to work. We both can walk to work if we need to. So that saves us hours in commuting, and that gives me hours in my day that I wouldn't have normally. And that's been really important, I think, to have some extra time to do other things. Other decisions we made, the gym that we joined is nearby the house, so theoretically we have no excuse not to work out. But it also had programs for kids because, we had no family really, and we didn't have any help for babysitting and that sort of thing. So to be able as a family to go do things like that. So again, purposeful decision. Other things we thought about early in our marriage, we both decided that housekeeping was not our priority and we didn't want to spend our free time cleaning the bathrooms. So even though budget was really tight, we decided to allocate some dollars to having someone help us clean the house. Again, maybe some people say that's a stress reducer, not for me, but those kinds of things help free up free time. The other thing I would say for fun activities or trying to have that balance of things outside of pharmacy, I literally put my fun stuff on my calendar and treat it like a meeting. And that means not always, but most of the time I get there. So if we're going to go biking or kayaking or doing whatever we're going to do as a family, it's on the calendar, and we have a family calendar because as two pharmacists, we're always vying for who gets to go to what meeting and all that sort of stuff. So anyway, I think just scheduling your time and spending some time, just downtime, making sure a week isn't so full that it's a chore to go do something fun, because you know that can happen. So that's what it works for us.
Thank you so much, Jan, for that. Bettina, so you have led state level association efforts in Tennessee for many decades, and through that work led many advocacy efforts for the pharmacy profession. So what opportunities do you see for further collaboration between state and national pharmacy organizations?
Well, I think the opportunities are immense, and I think timing has never been better. I think many of the successes that the pharmacy professions had recently is because of the successful collaboration. And I learned about that as a state exec. We were part of a loose-knit state organization. We'd get together and pat each other on the back, shake hands and say, it's good to see you. And then one day we said, you know, there's a lot going on and we could benefit if we could just collaborate with each other. So over 15 years ago, we formed something called the National Alliance of State Pharmacy Associations, NASPA. You know how we love our acronyms. We hired a very capable individual, many of you know Becky Sneed, to lead that enterprise, and we came together and started working and found out that states sharing best ideas could really help us advance practice in our states. And then we were lucky enough to have the opportunity to come and actually collaborate with the APHA Board of Trustees. And from that, we grew other opportunities, and just, you know, look today at things that are going on, the success and the advances that we're making with the Medicare effort that's now going on in Congress to expand opportunities for pharmacists to serve Medicare patients that are in underserved areas. In addition to that, look at the work that's going on with workplace issues and well-being, which is critically important to be addressed. And don't forget that many of those decisions are in the hands of Congress. And Congress come from states, and they get there by voters electing them. So it's very important that we have grassroots, on the ground efforts in states supporting the efforts that are going on and being led by organizations like APHA, and state associations can certainly do that. Just this past couple of weeks, I've met with new candidates in Tennessee. It is a passion of mine to make sure they understand the importance of pharmacy. And I do think that's an obligation, not just for organizations, but for pharmacists across the country to engage in those efforts of collaboration on these very important issues. But we're making a lot of progress. And I think, you know, as we keep saying, together we are stronger. Now we've demonstrated it by some of the successes we've had.
Thank you so much, Bettina. So Mary Ellis, can you tell us about the first time that you met Mary Louise Anderson, who was one of the original women recognized in the Women in Pharmacy conference room, and what impact did that have on you?
Yes, I can remember it vividly. I'm a little ashamed to say that I knew nothing about her when I met her, but I, as a officer in APHA, APPM, had the opportunity to attend a Remington Honor Dinner, and I was seated next to Mary Louise Anderson. I'll have to also confess that I'm not sure I really knew what it meant to receive a Remington Honor Medal at the time, but she had her medal on, and I don't think I knew any more about what she had done in pharmacy, and I don't remember a whole lot about the conversation, but I knew I'd met a remarkable woman and someone who was very interested in what I was doing and where I was going and how I was going to get there. Fast forward about 8 years later, I was sitting in that women's conference room upstairs, and she was one of the award winners, and she gave a presentation, and she was hilarious. I remember the story she told about being one of the first women and what it was like, and the challenges in a very funny way that she had to overcome. And it just seemed so remarkable to me that I had met this woman and didn't know anything about what she had done. But she remembered me and was excited to see that I'd had the opportunity to be a trustee and a presidential officer of APHA. And it brings to mind a statement that I heard Nancy Alvarez say in a leadership conference. She says, when you meet me, not my bio. And I'm so blessed that I met Mary Louise Anderson's, her first before I met her bio, because I was really blessed by that. And I sit here today thinking, I didn't really know her, but I feel so connected to her today, reaching back to those women that I heard present in that conference room in 2012, and then sit here thinking about the 9, 10 of us together today, and how we have that connection to the future women who will join these ranks as well. And there was a statement on the website for this recognition that really touched me, and I wanted to quote it. It says, each woman on the wall represents thousands of women standing behind them and thousands more yet to enter our ranks. And this feels like such a surreal experience. I feel very blessed to be here.
Thank you so much. All right. So Kelly, what has been your motivation for getting involved in leadership positions?
So, well, how do I follow Mary Alice? That's a little bit hard. So I'll do my best. But so I'm really a big proponent of leading from where you stand, which means my approach to leadership is really to be a doer. It means to set high expectations and standards and to model these standards and expectations. And I've had a passion for service and involvement, believe it or not, since I was a 4-H'er and served as president of my pony club. I've had a passion and it really, I guess it just grows on you. Because you'll find if you make the attempt that the motivation becomes that you receive so much more than you give. Some of my most treasured leadership experiences are the 18 years that I've spent in APHA leadership, starting with the APHA Academy of Practice and Management, where somebody told me that it wasn't slated first time, and then when I ran the second time, you'll never win. And so I think that that's important, and it really culminated as APHA president, and it's been about the journey. And so I think it's really important to understand that it's not about the position. The most meaningful part of leadership is about building and maintaining relationships along the way. And you've heard here many times that association membership is important and involvement, and it really is. As a Virginia pharmacist and never having lived anywhere else, sitting at the board table, people have been all over the country and all over the world. I'm like, well, I'm 3 hours from where I grew up and haven't been anywhere. But serving APHA in the profession has provided me with a network of wonderful colleagues and friends across the country and the world. And so it's so important.
Thank you so much, Kelly. Metaloo, your engagement in the Women in Pharmacy program since its inception is truly meant to be commended. So thank you so much for all of your personal time and contributions documenting the history of women in pharmacy and breaking glass ceilings. So how have you seen the engagement of women within the pharmacy profession evolve over your lifetime?
I was so privileged to be involved in selecting those 17 women in 3 organizations that went on the wall in 2012. The reason for this is because early on, I was being asked questions, especially from men, about women pharmacists and the history, and I didn't know the answer. So guess what? I had to go find the answer, which started that long time of researching women. The more I did this, I ended up with calling them, many of them, my hidden women. And these were the women that were doing wonderful things, being leaders and so on, but they were hidden. Nobody seemed to know about them. And that certainly goes through all the years. And even today, we have women doing things that we don't know about because they've done it because that's what they wanted to do and what was needed to do. And of course, part of this also then became the book, which we're not going to talk about.
What copies are upstairs?
My book is out of print, folks. There is a copy in the room upstairs. I do have to mention, as we talk about somebody, I have to talk about Zeta Mary Cooper, who's on the wall. She was an early woman leader starting, let's say, about 1900. She was very involved in APHA, AACP, and of course, responsible for Kappa Epsilon and also for Rho Chi. And again, a lot of people don't know about Mary. Zeta Mary. I'm sorry, I've worked with her so much. She becomes my first name, but she never was called anything but Miss Cooper. And anyway, as time came along, women began to recommend other women, and at the same time, they were being recommended by men. And I think the most wonderful thing today, after all my years in pharmacy, is that we see women more involved, and certainly have to, because women are now the majority. But don't forget, we need to keep the men involved.
Thank you so much, Metalou. Thank you for that. So Lucinda, this question will be for you, but first I'm going to give a little bit of background. So Gloria Niemeyer Franke was a trailblazer and a glass ceiling breaker for women in the pharmacy profession. APHA recognizes the spirit of her leadership through the Gloria Niemeyer Franke Leadership Mentor Award. We have several recipients of that award who are here in this room and on this panel, including you, Lucinda, Nancy Alvarez, Cynthia Boyle, Mary Alice Bennett, Becky Sneed, and of course, Metalou. Did I forget someone who's in the room? Okay, it's always dangerous to go a little off script. So Lucinda, tell us a little bit about Gloria Niemeyer Franke and particularly her influence on your career and others recognized here today.
Thrilled to do so, but it will take me about 6 hours.
About a minute.
Trailblazer is exactly correct. Pioneer. I am remembering the fact that when she was the first recipient of her named award, she read the letter that she got from a not to be named pharmaceutical company in the Midwest, she had applied to work with or for when she graduated from pharmacy school. And a very short letter came back saying, "We don't hire women." I know, shocking, shocking. So there has been change. I first got to know Gloria personally, thanks to the woman on the wall over there, who happens to be Mary Munson Runge, again, one of the first 20, the first female president of APHA, the first person of color to be a president of APHA. And stimulated probably by people like Gloria, Mary insisted on establishing the Task Force on Women in Pharmacy 40 years ago. I was just fresh out of my days as the second woman president of Student APHA, and I was determined not to get lost among the recent graduates. I wanted to stay involved because it had meant so much to me. And so I exclaimed that there really needed to be a student or young practitioner on that task force, and Mary fortunately agreed and appointed me. Gloria was the staff liaison to the Task Force on Women in Pharmacy, and she brought that experience of being told no and many, many, many others with her along the way. And as I reflect on it, we don't talk about it very much, but that task force reported out 40 years ago. Its main points were, we can't advance the profession and secure its future if we leave women unrecognized and unencouraged. And I'm so proud of the profession because we have actually done an incredible job of assimilating a demographic shift that other disciplines like medicine have yet to really actually do. We are ahead of the game. And we have Gloria and Mary Munson Runge and other people who have been mentioned to thank and praise and celebrate for that.
Thank you for that, Lucinda. So Cynthia, you and other honorees mentioned have been recognized with the Gloria Franke Leadership Mentor Award. How should a student or new practitioner reach out to a potential mentor, and what characteristics are important for a successful mentor-mentee relationship?
Thank you. I hope I can diverge one moment because I'm in the moment with comments other people have made. And we're very lucky, each of us, to have received individual recognitions of one kind or another. And more than one of us has commented on the fact that this feels like generational progress, right? So very different talents and change keeps coming, but it's very unusual to be recognized with others in the same way. So I just really appreciate the opportunity. But the question about mentorship is important. And, I grew up in Oklahoma. My first pharmacy degree was there. I was a Navy wife, and the Navy sent us to Florida and Texas and then eventually Maryland. So I really looked to people that I didn't know. I wasn't a graduate of any schools in those states where we soon lived. And so it became those professional associations, became people that you met, and it wasn't easy to do, and it probably still isn't. I think all of us are immigrants in the profession throughout our careers. Therefore, I gravitate toward a central mission to connect individuals and organizations to opportunities. And that means, connecting threads. It's so much fun to do, and finding interests. So it all centers for someone who's looking for a mentor on relationships. And yes, we can do things virtually and had to for a period of time, but I do believe those relationships can flourish in person. And so it starts there. And I think there's commitment on both sides. It isn't one directional, and you have to have an agreement. The communication part of it is what's needed. How are you growing? And eventually you'll find other people you need at your personal board of directors. And there are at least 3 of us here at the table that are all concentrating some of our efforts on one individual that we see promise in her. And so it's very fun to do, help them get out of the way. But we can take pride because that's the way I think we grow as individuals and as a profession.
Thank you so much for that, Cynthia. So just a reminder for those on Zoom, feel free to submit questions through the Q&A feature. We will open it up for the audience as well as those who are remote very shortly. So please submit those questions and we'll be ready to go there. So Beverly, we've heard about the innovations that you've led in your respective community pharmacy practices. So how do you encourage other practitioners to continue to innovate pharmacist services, or maybe those who haven't started, how should they get started?
So this happened last week. I went to a meeting, and it was a planning meeting, and they were asking, what do you think pharmacy is going to look like in 2027? What do you think pharmacy is going to look like in 5 years? And my first response is, you're asking the wrong question. What do patients want to see pharmacy look like? And that's what you need to be looking for, is ways to make patients' lives easier. Right now, they are so overwhelmed with so much information, but they don't have any way to sort through it and apply it to their specific circumstances. So what I think all pharmacists should be are health advocates. We can actually help people live healthier lives, and we can do it without necessarily being only the medication monitor. How about suggestions for diet, exercise, supplements, that kind of thing? So I foresee pharmacists being more proactive to the benefit of their patients' health. And the way that you do that is you find people that are already doing it and steal their good ideas. You visit their pharmacy and you say, I'm here to steal your good ideas. And what I do is I take their way that they're doing it, and I turn around and I tweak it a little bit to make it fit my Seattle audience. And everybody can do that. And finding good mentors through associations, through collaboration, through all sorts of ways. But I encourage people to connections, and it benefits everybody. It benefits you, it benefits your practice, it benefits your patients.
Thank you for that. Thank you. So Magali, one of your firsts is being the first Latina to serve as APhA Foundation president. Our current APhA Foundation president is Dr. Anjanette Wyatt, the first Black female to serve in this capacity. What words of wisdom do you have for other persons of color who might not see others who look like them in leadership positions?
First of all, Anjanette, congratulations. I'm very happy to see you there. I think above all, the key thing that I want people to remember is that you should never allow your race, your ethnicity, your differences define who you are. And above all, you define yourself. Never let somebody else define you, tell you what your value is, and that should be given only by you. Again, I think it's important to set goals. We all talked about setting goals, and then prepare yourself to achieve those goals. Even if you don't see people that look like you in leadership positions, that should not be a reason for you not to aspire to be one, because maybe that is how it should be or could be. So again, you could make the difference. Again, I think that it's important to set those goals, even if they are unattainable. Be patient. You're going to get there. You're going to achieve them. I think it's also very, very important to be honest with yourself. I really believe that it's critical for you to know who you are and what your strengths are. I'm a believer that you should follow opportunities that meet your strength. Follow your strength. Don't harp too much in your weaknesses or what you are not good at, but position yourself in those in which you know you're going to excel. But get to those positions always with the mindset of knowing what are you bringing to that position? What is it that you bring in? What are your talents? How are you going to make that organization or that, position better because of who you are and what you bring to it? Then once you achieve your goal, then I tell you, it's very humbling, amazing, and satisfying. When you are an individual of color that is opening doors for others, maybe you didn't even set yourself to do that. But when you see others coming to you and you become like, it was said here, thousands of women, right, that are behind us, is very gratifying. So in summary, I think stay the course, excel, achieve your goal, but do it for yourself, not for others.
Thank you, Magali. So Pam, what advice would you give a female student pharmacist with the desire to achieve the impressive career accolades that you have achieved?
Well, first of all, I can safely say that this is nothing that that I planned for. It's nothing I sought to try for or anything like that. And I would say safely that every single person here feels the same way. And I think what drives all of us more, because I'm noticing that really common theme here, is that we really want to make the world a better place. I mean, it sounds really weird to say that, but that's actually the genuine truth. So what I think it came down to more was timing and support systems. And I'll explain why that is. Because what ends up happening is you have these different opportunities, you have doors that open for you, and a lot of times people don't even realize, when you talk to people, they don't realize that's a door. But what happens is the timing isn't right, or maybe there's something not right, you can't go in that door. So there's opportunities out there, it's a timing. And then the other thing I'm going to tell, this is a trick that I share with not very many people, is that I learned somewhere in there what it really means to be mission oriented. I learned to understand the agency mission, the organization's mission, whatever that mission was. And it took a while. I always spouted it off, but you really never understood it. But once you understand it, there's other opportunities. And I would always pick something, a project. I go, can I work on this project? And it's something that I knew was important to the mission, all the way up to the top, but nobody wanted to work on it. So I took the leftovers, I guess. I made my whole career on things that people didn't want to do. And I'll give you, I was a clinical pharmacist. I worked in clinical setting. I love my life. I loved all the clinical programs we were doing, but we needed work in the infrastructure for information technology. I did not like that topic. Don't tell everybody I didn't, because I do it all the time now, but I did not want to go in there, but it needed to be done. So you dive in, you learn. And then from that, it went on. You go to regional, you start influencing different things and getting involved in a zillion projects that actually helped change not only my organization, but also the profession. And you just don't realize that's happening when you're in it.
Thank you, Pam. Thank you for that. So I'm going to pose one more question to Jan, and then we're going to open it up to the audience. We already have some questions from individuals who are on the Zoom as well. So I'd love to take another 10 hours, but we're time restricted. So Jan, can you give an example of how a mentor impacted you in your career? And how about how a mentee has impacted your career?
All right. First thing I will say is mentors come in all different shapes and sizes. It's not one particular thing. Early in my career, we had a faculty member at Rutgers where I went to school, Ina Calagaro. She was one of our first clinical pharmacists at Rutgers, and she was a pediatric neonatology expert. And she really encouraged me to think about patient care. So I graduated, I went on to become a full-time hospital pharmacist, and I worked in an independent community pharmacy at night. I had loans, so I was doing a lot of working. But anyway, what I realized while I was working is I didn't have the skills that I needed to do the kind of patient care I wanted. And Ina was there for me that whole time that I was working. I could call her, she'd help me with my drug information skills, finding articles, doing whatever I needed to do to take care of patients. And she encouraged me to go back to school, which was tough after working and having a little bit of money, although I had those loans. But anyway, I went back to school, and I was lucky enough. Ina's husband is a physician, and he got a fellowship at University of Chicago, and I was at University of Illinois. She ended up on faculty. So I had her for my whole PharmD program and my residency, and wrote my first paper actually with her. So, if it wasn't for her, I don't know if I would have had the guts to go back to school. But there's lots of other mentors in my life. I have a network of friends that I can call on at any time, right, Magali? Yes. I'm always, especially years ago, we were the first ones who were married, got kids. What do you do with them? I remember, my daughter was 5 weeks old when I took her to my first APHA board meeting, and it was like, do you sit her under the table? What do you do with her? My husband's awesome, so he took care of her. But, and my husband's one of my best mentors too. I'm so lucky to be married to a pharmacist. And then in terms of other mentors, so you've got Andy, who's a hospital pharmacist with ambulatory care. During COVID, I needed to hear what's going on in the community. And then I have another mentor who is a student pharmacist at University of Pittsburgh, and that happens to be my daughter. And she had no qualms about calling me up, Miss ACPE. You need to change this or that. But to hear the student perspective and the practitioner's perspective, when we were at ACPE trying to figure out how do we help the schools. I mean, they didn't have clerkship sites, they didn't know how to do labs, and we didn't want to be a barrier. We wanted to have flexibility, but make sure the students who graduated were practice ready. So you get mentors from all over the place. And then also, I hope I'm a mentee to that little student pharmacist who has no qualms about telling me my main job is mom. She doesn't care what my title is. So I think that's a good lesson as well.
Thank you so much for that, Jan. Okay, so we're excited to open up the Q&A to the audience here, as well as those remotely. So I'm going to take the first question from those who are remote. But if you're in the room and you have a question, please raise your hand. APHA Foundation staff will ensure that you get a microphone, and then I'll go to you next. So first question. So thank you for sharing your inspiring comments. What is something you would tell your 25-year-old self if you could? And I'm going to pose this question over to Mary Alice.
I'd like to think I can remember my 25-year-old. And that my 25-year-old self definitely was in a different era than today is. But I still don't know the potential that I have. I think I don't identify what I can do and how I can influence. And so I wish the word isn't confidence, but I wish I had more maybe belief in myself. And my husband's going to die in the back room, but I wish I'd taken more risk because he thinks I've probably taken more than I should have. But I just to put myself out there and to try things earlier than what I did. And to believe that I could lead and to believe that I could influence and just reach out to other people to help me do that, that I didn't need to be alone in taking on those challenges. So I would say belief would be the big thing.
And it looks like Elisa has a question. So.
Yes, thank you. I am in awe. This is just amazing. All that I've heard, and I think everybody, speaking for everyone else, this is amazing. So thank you for being here. There are so many, glass ceilings that were broken on this panel. And the first, it's amazing, and the information that we've heard, just trying to synthesis is incredible. I'm just wondering if I could challenge you in 1 to 3 words in a quick lightning round of what advice from all that you've talked about would you give to the students today, whether it's female or male, because I think a lot of what you said crosses across the not only generations, but genders as well. So 1 to 3 words.
All right,
go.
we'll start with Magali and work our way down.
I think take risk, but above all, something that is important is family. You have to have the support of your family and a great family behind you.
Thank you.
Engagement, mentorship, and relationships.
Get involved.
Try something new.
Commit to advocacy.
Live your values.
Always ask questions. Don't be afraid. Don't let fear stand in your way.
That was what I was going to say. So now I have to think for a second. Ask for help.
Take a lot of risks because it pays off.
Oh, this is hard being last. Networking, dive in.
Thank you for that. Wonderful and inspiring. So we'll go to a question from those who are remote. And again, if you're in the room and have a question, raise your hand high and we'll get you a microphone. So what a blessing to hear such one powerful advice from so many distinguished women pharmacists. My heart is full. Could the panelists peer into their crystal balls? What do they foresee as emerging issues for the profession? What areas can the next generation of women pharmacists help to address in order to build on the legacy that they and those before them have laid to advance the profession? And I'm going to hand this one to Metaloo.
I knew you were going to do that. I just, again, would say, keep going, keep being, yes, you're a woman, but don't act that you're the woman. Don't go into a room and say, I'm a woman and therefore you have to do what I say. I've listened to that too often. But really, again, you don't know what pharmacy is going to be like. So don't be afraid to be the first one to say yes to something. And then, but if you say yes, you've got to do it 200% of the time.
Thank you, Metaloo. Over to you, Lucinda.
In another context, I think the most important thing that any and all of us must do is stop telling pharmacists how good they are. The public needs to understand how good we are. And we haven't really gotten that started or effectively done, even unfortunately with COVID.
Thank you for that, Lucinda. Any questions? Okay. We've got a question in the room.
Good morning. I'm Terry Moore, and I am like, this is surreal to just be in this space with so much positive energy. And it reminds me why I love this profession that I've been in for more decades than you all probably would believe. But what my question kind of piggybacks on the one that was just addressed. And we always talk about the issues in pharmacy. What would each of you or whoever wants to answer, what should be our number 1, 2, 3 priorities right now in terms of accomplishing what I hear some of the goals? What should be the priorities? And I think across all the things I hear all the time, like we should be doing this and what's transformation and how to be innovative. But if you could say in a short 1 or 2 words or sentences, where should we really be focusing our attention as a profession to move us forward?
Perfect. Maybe we'll take that one to Beverly first.
Thanks. So I think patient health needs to be our focus, not medication management, not third parties, not anything else. Improving patient health. And there's so many ways that we can do that as pharmacists that are not related to dispensing and prescribing and that kind of thing. So I think our focus really and truly needs to be improving patient health.
Thank you for that. And Bettina.
I think active advocacy, but one of the things, and I'll put this on the foundation and some of the organizations that focus on this. I think that certainly patient outcomes, I think the quality of those outcomes is critical, that's defined and measured, because I know that's how other healthcare entities have made progress. I think pharmacists are doing some incredible things, but the things that seem to be reported and measured are not those things. So somehow we've got to work to get the system to really focus on the things that we do well. It takes time, it takes money, and it takes people who are willing to participate in those types of events. But that's going to be critical, I believe, for us to be able to get the opportunity to expand the services that we're now delivering to the public.
Thank you for that. And we'll go to a question we received remotely. So what advice does the panel have regarding any pharmacist, whether male or female, experiencing imposter syndrome during any point in their career? And maybe if I may, I'll pose this to Cynthia first.
I know it's a prevalent term these days. I just don't agree with it. I understand you're put in roles sometimes for which you haven't had appropriate training. And so therefore being your own advocate to what do you need to be successful? Maybe it's not a good fit and a change needs to be made. So perhaps a change needs to be made is the bottom line. But also stepping back from where we are now, we're in Washington, D.C. And I'm thinking that, especially as we focused on women, that for example, I'm doing a rewrite of a history chapter in women's health across the lifespan and access pharmacy. We're coming up on the 3rd edition. I did the 2nd one. And when I approach that material, I'm very concerned of what's being lost. And there's chaos in women's health. And, where progress had been made to get women involved in testing and research and all of that, I'm really thinking hard about what I'm going to write. And the reality is we actually had a conversation earlier, the Equal Rights Amendment has not been passed. So there are things we can do at local. This is maybe bigger than you asked, Farah, but I'm concerned about that because given all of us as citizens, as people who are helping others, we need access to these things.
Thank you. And
Yeah, I'll make just a comment on that, on a comment in general on that topic. So I guess what I'm thinking is women, we need to realize that at least I'm this way and I know others are thinking that I shouldn't be at the table. I shouldn't be here. And it's just it's built into us, like the confidence piece. And so knowing that, and where guys are thinking, okay, I'm maybe 20% qualified, I can do it. And where we're the other way around. So just knowing that and just factually remembering that, remember we could do it if we're only 50% there, just because we just have to take that chance and go for that. So guys need to realize that women are thinking that way and to help encourage them. You can do that and help them give the confidence. I think guys can help a lot with that. And then women, we just need to realize we're naturally that way and we need to support each other in taking those risks to jump in and not feel like shouldn't be there.
thank you, Pam. And we'll go to Anjanette. Oh, get a microphone.
First, I want to say I'm so impressed with all of the ladies that stand before me. And I just want to thank you for being here and for your service. The first thing I want to say is that today you have provided us with a plethora of what I call pharmacy pearls. And, as ladies, we love our pearls. We love our pearls. And so, you guys have added 10 pearls to the strand for many women across the nation and those of who are here and also that are on the line. My question to you today is, in America, maternal mortality has increased, surpassing third world countries. And as women pharmacists, I want to know what you guys think we can do to band together to address maternal mortality in America.
Thank you for that, Anjanette. Maybe we'll go to Lucinda.
I know enough about this to be dangerous. But as I've been dedicated, especially over the last several years, to understanding the real underlying issues in this and so many other health equity issues, tragedies in our country, I think, first of all, we've got to bolster the research to be able to answer the questions of why. I can't answer the question of why, but I do know that a part of the answer is social determinants of health and health inequities and disparities. And so I think we also have to get after how can we address those in a sustainable fashion in order to eliminate that scourge on our country and on the women and the babies who suffer as a result.
Thank you for that, Lucinda. And we do have an individual who's raised their hand remotely. So Brian, if you could unmute them and we'll go to them. Okay, it looks like you are unmuted. Emmeline, if you'd like to ask your question, go ahead.
Yes, thank you. Emmeline Paintsel. Just want to say thank you to each and every one of you for the work that you've done and to APHA Foundation for making this event possible. So as pharmacists, we're altruistic, sometimes to a fault, and as women, we're naturally helpers and givers. And I know that in this realm of work, pursuing opportunities and getting involved is important. So my question is, what advice do you have for avoiding overcommitting and avoiding burnout while still being of service and maintaining integrity?
Thank you for your question. I'd like to send this one to you, Jan.
I think it's really important to assess all the opportunities that are out of there. Somebody had asked, what would you tell your 25-year-old self? And back then is like, don't say yes to everything, because then you end up just being stressed out and you're not necessarily valuable to your home, your family, to your job, to the volunteer roles. So, I think it's pick and choose. And what Magali said, look at your strengths. Don't worry about your weaknesses, but figure out where you're strong and then use that to determine what kinds of activities you're going to take on, and be realistic about what kind of time you have. Because always, I tell my students, when you volunteer, you want to do a good job because people will remember if you don't. So you want to make sure it's something that you're passionate about, that you have something to offer, and not to overcommit, and to think about your whole lifestyle to make sure. But I still recommend getting involved. And my other comment about that is take time for yourself, have well-being, but there are going to be times you have to work nights and weekends once in a while. I mean, and you do anyway with patient care. I'm talking about for volunteer type stuff.
Thank you.
But
Thank
it's
you.
worth it.
Thank you for that, Jan. Thank you to all of our panelists for your insights. I know we have a few more questions, but unfortunately we're running up against time. It has been an absolute pleasure and an honor to be moderating this panel with all of you. Thank you for sharing your insights, your pearls for mentorship, for leadership, for practice innovation and philanthropy. So thank you for that. I'll hand it over to Elizabeth to close out today's session. Thank you once again.
Thank you all. One last hand. I hope you've all enjoyed this, both those of you that called in, thank you for doing that, as well as that are here. And there was so much incredible information shared. If I could summarize in 3 primary themes that I heard was networking, take some risks, and find your passion. And if you have, if this has sparked some passion or an interest in networking, then it's all been very successful and worthwhile. And along those lines, with a somewhat shameless plug, if you have enjoyed today's program, please consider a contribution to the APHA Foundation. Your donation helps to continue efforts in the advancement of women in pharmacy in all areas of practice, and to celebrate the achievements of women throughout pharmacy's history, as well as our research and innovation efforts to further patient care. Thank you once again for our very generous supporters, Bristol Myers Squibb, Cardinal Health, Gainwell Technologies, and Moderna. Thank you to Farah Tofik for moderating the session. And thank you again, and congratulations again to the next 10 women in pharmacy, and for your participation and insights. It's been a pleasure. Thank you.